Let's study gum disease together. So, if you have the Dentalelle Masterbook, this is the chapter on gum disease, and I'm going to go through a few pages with you. The gum disease and implant chapter is about 28 pages, so there's a lot here, a great summarized way to really study what you have to know for the board exam. So, you'll notice there's some true and false questions here, so yes and no. It kind of gives you an idea of what you need to know when you're thinking about gum disease. So, for example, gingivitis causes permanent bone loss around the teeth. Is that true or false? Well, that's false because gum disease, gingivitis specifically, is reversible. It's periodontal disease that we have to be concerned with because that includes bone loss. Gingivitis does not. Gingivitis, think of it as gum disease for the gums, whereas periodontal disease is more than that and it starts to spread to the bone. Now, smoking, is that a major risk factor in periodontal disease? Well, yes, it is. Those that smoke have a greater chance of developing periodontal disease. The one thing you have to remember too is just because you have gingivitis does not mean you're going to get periodontal disease, especially if you're able to reverse it. But let's say you have a severe form of gingivitis. It doesn't mean, though, you're automatically going to get periodontal disease as well. Sometimes you can have periodontal disease, but not gingivitis. If you're able to maintain the gums, they're nice and healthy, pink, stippled, not shiny, but you still have pockets of 4 millimeters. Even if there's just one pocket of 4 millimeters, you have periodontal disease. Now, you could have gingivitis with periodontal disease or periodontal disease with no gingivitis. Those kind of go hand in hand. It just depends on the oral condition of the mouth. Now, once a periodontal disease develops, it is reversed by brushing. No. Periodontal disease, as we know, is greater than that. It's bone loss. You can't just simply brush the teeth away for bone loss because bone loss, you can't build the bone back. You can have surgery to repair it and build it up again, but it doesn't naturally come back. So that's a very important note. Now, early periodontal disease often progresses silently without pain. Yes, even gingivitis could be silent. Somebody might not know they have it. If they have bleeding gums, well, that's gingivitis. But people might think, oh, I thought my gums were just bleeding because I was brushing too hard, or I was flossing too hard, or I had something stuck in there. Healthy gums do not bleed, but it doesn't mean there's going to be pain. Other times, their gums could be in pain with a little bit of bleeding, and we might think, oh, is that gum disease? It is, but is it bad? So sometimes you can have pain and sometimes you can't have pain. And talking about periodontal disease as well, there's not always pain right away. Both conditions may show bleeding, swelling, and redness. Yes, so periodontal disease could also have bleeding, swelling, redness, along with bone loss. So now coming down here to gingivitis and perio, well, again, gingivitis is reversible, but periodontal disease is a chronic condition affecting the gums and deeper supporting structures like the bone and the periodontal ligament. So think about the bone and the ligament. So that sulcus area is what we're talking about when we're talking about periodontal disease. I had attached a little picture here of of a bone because I thought, while you're studying, you'll remember that image of a bone and think, okay, periodontal disease. This obviously isn't a bone in your mouth, but it's just kind of meant to guide you in your studying. That's why I love the master book so much because you're studying in a different way whether you know it or not because there's pretty pictures, there's pretty colors. I know it sounds silly, but it's so true. Your studying is so much more effective when you have something to look at. If you're just opening up the textbook, it gets boring, you don't want to study, and then you don't pass because you don't know the material that you need to know. And gingivitis, here's a great example of redness along the margins, one of the first signs of gingivitis. Now, again, taking gum disease as a full category, let's dig deeper into gingivitis and then periodontal disease. So, gingivitis, the primary cause here is going to be plaque. Plaque starts, and then you have calculus. Technically, you have biofilm, which is a little bit earlier than plaque, and that's what that says here, plaque biofilm. And then you have plaque, and then you have calculus. But what does gingivitis look like? It's basically a redness, swelling, could be pain, could not be. It could not have pain, but your body's fighting inflammation. That's the key here. So the bleeding and the redness is a bad thing, but it's our body's way of trying to fight something that it doesn't like. So it's good. It's kind of like if you have a cut on your finger, it's going to be red. It might even bleed, but you have to clean it really well for it to heal. It doesn't mean our body is trying to attack us, but it's trying to attack the inflammation. We need to help the body by cleaning it. We need to help the mouth, help the teeth by a good dental cleaning to start to heal things up so the gums can heal after that. So, how does gingivitis happen? Well, how does plaque happen? Poor oral hygiene, maybe certain medications, maybe certain hormone changes, maybe somebody's not eating properly, getting enough vitamin C. There are so many factors. But if caught early enough, it is reversible. If left untreated, though, it can go on to periodontal disease, and then it's a lot harder to treat, but still treatable. But once it hits periodontal disease, you have that pocket of 4 millimeters. You have the bone loss that could happen eventually. So, and it can get worse and worse. This image here is periodontal disease. It's so much more than gingivitis, but it's showing you what red puffy gums look like. This isn't normal. This isn't healthy. Now, what about periodontal disease though? How does this happen? To keep it simple, it's if the gingivitis is left to get worse, or if the patient's not brushing, is not flossing, they're not getting regular teeth cleaning. So it's very persistent bacteria that has now traveled underneath the gum line to cause periodontal disease. But it could also happen from smoking. It could happen from age. As we get older, even if we're brushing really, really well, sometimes we need teeth cleanings more often because it's very hard for us to get in there the older we get, and we need extra dental hygiene care. But please remember, periodontal disease is irreversible. It causes permanent damage. You can maintain it, but it's irreversible. You cannot build the bone back, whereas gingivitis is reversible. So, again, I dig into it a little bit deeper here. What's the cause? What's the immune response? What's the tissue effects? So, the cause, to keep it simple, of gingivitis is going to be plaque. Plaque causes the body to go, what the heck? We don't like that. So the white blood cells, the neutrophils, are going to be activated, releasing more bacteria. I mean, they try to help the bacteria, they try to fight it off, but there's more things being released that causes the body to be inflamed. Now, what does this look like? This looks like red bleeding gums. Sometimes the gums are bleeding, or sometimes the gums are red but not bleeding, but when you touch them, they start to bleed. The best thing to do is improve oral hygiene. It might hurt. If the gums are red and puffy, it might hurt, but you still have to clean the teeth well to get rid of the inflammation. If you have a cut on your finger, or your hand, it's going to hurt to clean it, but you have to clean it so that the body can fight it, and then no more inflammation. What about periodontal disease? How does that happen? So again, it's persistent plaque that goes underneath the gum line now. So it's more plaque, more tissue destruction, more things are trying to fight. The body's immune system has more happening to try to fight everything, but it's happening fast. There are many different forms of periodontal disease. So you have to think, is this a chronic form? Is this an acute form? Is this an early, moderate, or advanced sign? So there's many different details that we talk about a little bit later that you need to know about. So gingivitis, perio, what are the key differences? I would say the key differences are bone loss. Keep it simple. Don't make it complicated. If there's bone loss, that's perio. If there's a pocket of 4 millimeters or more, that is perio. Now, we need to assess before we know if it's acute or chronic or early, moderate, advanced. We have to assess the gums. We have to assess the mouth. How do you assess perio? That is by probing. Probing needs to be done at least once a year. I personally probe my patients at almost every appointment. So at least every 6 months, because I don't want to miss something. Maybe last time when I was probing, they had extra inflammation, so the pocket might not be a true pocket. I probe every 6 months, but I have my own dental hygiene business. I have the time, I can do that, and I make the time because I care about my patients. I make the time. I'm my own boss, so there's nobody yelling at me to hurry up like they would be in the dental office. office, but I'm my own boss. So this is the only way to really assess perio, but also to see, is that perio getting better or is it getting worse? In some cases, if they have a moderate form of perio, they already now need to be referred to a periodontal specialist, a dentist who specializes in periodontal disease, because they have the right tools to get into those deeper 6 millimeter pockets that I might not feel comfortable with because I can't see. I don't have those tools. I'm not a specialist. So we need to assess to figure everything's out. Here is what a probing could look like. Here is what the odontogram for perio could look like. Notice the different bleeding scores, the different pockets. Red is meant to alert our attention and be like, okay, we have to talk to the patient about this. It looks like they also have gingival recession. See this pink, purple sort of triangle? That is showing you gingival recession. It's meant to really show us kind of what's happening quickly, easily, so we can talk about it with our patients. Always tell your patients what is going on. The different types of perio. We have chronic. Is it going to be acute? Is it going to be chronic? Is it going to be an aggressive form? What about from a systemic disease? What about necrotizing? So tons of stuff here. Now, in your gum disease pages for the master book, as you can see, there's tons. There's 28 pages here. We just went over a little bit today, but that is meant to really get you started on studying for gum disease. Let me know if you have any questions. And don't forget about implants, because when you're talking about implants, that's different than your true tooth. Gum disease can happen quicker because the implant just happens, right? Implants are amazing, but if they're not cleaning them properly, gum disease can happen so much quicker. We'll talk about that in another video. But then we have special needs. I like to tie in special needs with the gum disease unit because it does kind of go hand in hand. As we get older, we are more prone to gum disease. If you are a member of the Dentalelle Board Exam Prep Academy, you will have all of these class recordings where I have talked about gum disease. I have gone through every topic you need to know for the board exam. This master book is an amazing tool. So if you don't want to read your textbook or you don't even want to read the study sheets that I have for you inside the course, you can open up the master book, because some of us, I would say most of us, are going to be visual learners. So we love to see something pretty. But I hope this helped. I hope this helped to really narrow down gum disease for you. You can study on your own and let me know if you have any questions. I am always here to help. Thank you guys for watching, and click like if you like this video. That does help me, and I'll see you guys in the next one.